listening to part 62 of our series, 7 Medicines, The Wise Woman Way, with Susan Weed at Time Monk Radio. Hello, Susan. Welcome back to Time Monk Radio.
Hi, Gemini. Did you manage to have some fun this week?
I did. What about you?
I absolutely did. And having fun reminded me of this kind of silly study that they did with people to see, if putting a smile on your face could actually, ease depression. And they took a group of people and they showed them some cartoons. And they had them rank the cartoons. And then, at some later time, they had them put a pencil in their mouth while they looked at cartoons and ranked the cartoons as to whether they were funny. And when they had the pencil in their mouth and tried it, makes you smile, they found the cartoons far funnier. So, does the tail wag the dog, or is the dog wagging the tail? When we want to not be depressed, what we're talking about is that we don't want our brain to be producing certain hormones, and we want our brain to be producing more of certain other hormones. And strangely enough, the only key to that castle is not drugs. Simple things like smiling, walking, engaging with family and friends, those things actually do change depressive states. However, most of the time, when we go to a doctor and say, oh my, I'm depressed, what they're going to say is, let me prescribe an antidepressive drug. And those antidepressive drugs come in a staggering array of types and styles and actions and so on. However, the major side effects of all of them are pretty similar. And they include confusion, delirium, short-term memory problems, disorientation, and impaired attention. Remember, we're mucking around with the chemicals in the brain now. And that leads to things that are especially problematic as we age, or for people in certain situations. So while on the face of it, saying, it causes short-term memory problems or disorientation is not too bad, but if this is added to those kinds of problems which are already present on a day-to-day basis, they can actually lead the person into very dangerous situations. That's just the mental effects. The physical effects include dry mouth, constipation, difficulty urinating, blurred vision, decreased sweating, increased body temperature, sexual dysfunction, worsening of glaucoma, dizziness, changes in heart rhythm, lowering of blood pressure. This, like the mental effects, is quite troublesome if the person is already taking antihypertensive drugs, because that could lead to a really severe drop in blood pressure. In fact, the complications of depression are much worse if you're taking drugs to lower blood pressure. People who are depressed often don't eat and don't drink, and they get dehydrated. And dehydration makes the blood pressure drop. And then they take their daily drug to lower their blood pressure, and wham! A drug-induced drop in blood pressure results in injuries, heart attacks, and strokes. Anybody considering taking antidepressive medication should get a baseline electrocardiogram beforehand. In addition, physical effects such as lack of arousal, inability to orgasm, and dangerously low blood sodium, especially in the elderly, have been noted. All antidepressants carry a black box warning that they will increase the risk of suicidal thinking and behavior in children, adolescents, and young adults. So remember that I said at the beginning, the only thing that really troubles us and worries us about depression is that depression can come with this suicide factor. And that's why some people say, well, we need to use the drugs. And yet, the most vulnerable populations, the ones who are most likely to have suicide thoughts, if given antidepressants, will have a noticeable increase in those thoughts and in their ability to actually kill themselves. So what we're saying is that antidepressant drugs are scariest when used for younger people. What happens when you want to withdraw from the drugs? You will get dizzy, you will get nauseated, you will get a headache, you will say, wow, I am really moody, and goodness only knows what's going to happen to your sleep. In fact, all of the things that you started taking the drug to kind of get away from are going to come back really big. So, safest way to use any antidepressive drug is to start with a tiny, tiny dose. Remember that while all antidepressants are equally effective, or shall we say equally ineffective, what works for one person is not necessarily going to work for another. It can take you some time to find the right drug, but start with a tiny dose and take it at bedtime. You could start with a third of the usual dose, and then increase that dose very slowly. Give yourself about 3 weeks to see an effect. Continue if you feel that the drug is working, or discontinue if it's causing persistent adverse effects. If you feel that it's working, discontinue use after 3 to 4 months by lowering the dose gradually. All right, let's look at what these drugs are and what they do. SSRIs, those are the ones we know about, right? Selective serotonin reuptake inhibitors. These are the most commonly prescribed antidepressant drugs and, hooray, the safest. Serotonin is a brain chemical that basically lets us focus in on one particular part of the sensory experience. We often notice that when we kiss someone, we close our eyes. We're doing that to block out visual input so that we can really focus on the pressure sensations and the texture sensations of the kiss. Serotonin acts like that. It can close our eyes to certain things. And when there isn't enough serotonin in the brain, then all of the sensory inputs come in without any volume control. In fact, this is what lysergic acid diethylamide 25, LSD, does, is it temporarily, for a period of 8 to 10 hours, turns off serotonin production. So all of existence is coming in full force without much way to really discriminate between it. We can see why that would cause some people to think that they might be a little crazy. They weren't really. But on the other hand, the ability to have that serotonin is what keeps most of us feeling like we're sane and we can function. So the selective serotonin reuptake inhibitors inhibit the reuptake of serotonin, so the serotonin stays in your brain longer. The very first SSRI, Prozac, was approved in 1987, and it replaced the tricyclic antidepressants and the monoamine oxidase inhibitors, which we will talk about, both of which had far more severe side effects and could even be fatal. Currently used SSRIs include Zoloft, Celexa, Oleptro, Paxil, Paxiva, Prozac, Serafem, Lexapro, and Luvox, and Susun. The most common of the side effects from taking SSRIs are mania and sexual problems. But sleeping problems, nervousness, tremor, sweating, nausea, and serotonin syndrome, a life-threatening condition involving agitation, hallucination, loss of muscle coordination, seizures, vomiting, and diarrhea is also a possible side effect. All of the currently available antidepressant drugs appear to reduce hypomaniac and maniac reactions. Appear to be able to induce, all currently available antidepressant drugs are able to induce hypomaniac and maniac reactions. This reaction can be severe, requiring patients to be sedated for extreme agitation, and is a serious concern for people taking SSRIs. Serotonin and norepinephrine reuptake inhibitors, SNRIs, target both serotonin and norepinephrine. Norepinephrine and epinephrine are, again, brain chemicals. You've probably heard of epinephrine in terms of losing weight, but you've probably also heard that some people died from taking weight loss supplements containing that. So as with the serotonin, there are levels of norepinephrine and epinephrine that are needed for healthy brain functioning, but levels that are too low or too high can lead to distressing things. So the serotonin and norepinephrine reuptake inhibitors inhibit the uptake of these brain chemicals so that more stays in your brain, and hopefully will reduce depression symptoms as well as relieving pain. And this is one of the reasons that SNRIs are sometimes chosen. However, the price of SNRIs has been going up and up. A recent analysis found that a 30-day supply was over $200 compared to about $10 a month for an SSRI. Some of them currently used SNRIs include Prestique, Kedezol, Fetsima, Cymbalta, and Effexor. In addition to the nausea and sweating and sexual problems caused by the SSRIs, SNRIs also cause constipation, dry mouth, cough, shortness of breath, and internal bleeding. Tricyclic antidepressants are now prescribed when other depressants don't work. And we don't really know how the tricyclics work. Older adults seem to be especially sensitive to harmful effects from tricyclic antidepressants. And at this point, the medical profession suggests that drugs in this family should not be used unless absolutely necessary. These would include things like tofranil, anafranil, norpramin, Pamelor, Sermontil. If you're taking any antidepressant drug, check with your doctor and make sure that it's not a tricyclic antidepressant. Same old side effects, but now you can also add in a regular heart rate, and seizure as side effects. So we can see why the SSRIs became so popular, since in this rather difficult environment in which a lot of problems occur from taking drugs, those that have fewer problems are certainly the ones that we want to look for. In addition to those primary types, there are also dopamine reuptake blockers, 5-HT1A receptor antagonists, 5-HT2 receptor antagonists, 5-HT3 receptor antagonists, and monoamine oxidase inhibitors. The tetracyclic antidepressants are rarely used now. Maplotylene is the primary one, and it was said to balance neurotransmitters. The symptoms are no worse than selective serotonin reuptake inhibitors. The dopamine reuptake blockers are still quite used, and they include things like Wellbutrin, Forfivo, Aplinzin. And they block norepinephrine as well as dopamine from being reabsorbed in the brain, so they stay in the brain longer. They find that the dopamine reuptake blockers are especially effective for people who have gotten depressed because they stopped smoking cigarettes. The MAOIs, monoamine oxidase inhibitors, are older drugs that actually stop the breakdown of norepinephrine, dopamine, and serotonin. They interact with just about everything, including prescription drugs, non-prescription drugs, and even a lot of foods, and they can't be combined with any other stimulant or any other antidepressant. And thus, at this point, although the MAO inhibitors work pretty well, they are last resort, and these would include drugs like Nardil, Marplan, MSAM, and Parnate. MSAM is a transdermal patch, which can sometimes be a nice way to take those drugs. And their side effects are minimal, more in the order of the SSRIs. Noradrenergic antagonists, including Remeron, can alter even different chemicals in your brain with not so much side effects. There are, in addition to all of these antidepressant drugs, and believe me, I did not read you the names of all of them because, as I said in the beginning, there's huge amounts of them. There are also atypical medications. So, for example, Symbyax treats bipolar disorder and depression that hasn't responded to any other drugs. And these atypical medications are usually not given at first. Usually the medical profession wants you to wait 8 or 12 weeks and maybe even longer just to see to it that you're not really going to respond to any of the other drugs before taking the drugs here, which would include some drugs that are considered to be antipsychotics and were actually developed to treat schizophrenia. Some of them also are combination drugs. So this is somewhat confusing, but I mentioned it before. You might be taking one pill, but in that pill are 2 or 3 drugs. You have to read your labels very closely and question your doctor very closely, too. The atypical medications include Abilify, Fanapt, Safris, Zyprexa, Seroquel, Seroquel XR, Clozaril, Invega, Geodon, and Risperdal. Evidence indicates that very few of these antipsychotics will be a good choice. Medical opinion suggests that you increase the dose of an antidepressant that you're taking that works, or switch to a different one rather than using any of these atypical medications. The antipsychotics cause serious side effects, including involuntary movements of the tongue, lips, face, trunk, arms, and legs, significant weight gain, increased risk of type 2 diabetes, increased risk of heart disease, increased risk of stroke, and some of them cost up to $1,000 a month. Woo! That's a lot, isn't it? Other medications that the medical profession might suggest, and some of them are pretty interesting. Thyroid hormone. Depressed, try some thyroid hormone. Pretty nice profile on thyroid hormone if it does it for you. Better than taking some of these other things. Low doses of stimulants. Ketamine. Oh, read up about ketamine. Ketamine is a lot of fun. Lithium. Often used successfully to treat people with bipolar disease, especially people who have very depressive episodes of their bipolar disease. Electroconvulsive therapy, transcranial magnetic stimulation, and vagus nerve stimulation are also things currently offered by the medical profession if you have severe depression. That electroconvulsive therapy, well, we all saw One Flew Over the Cuckoo's Nest. And so, we're thinking like fry your brain. But I have talked to some people who have done modern electroconvulsive therapy, and I was surprised to find how much she thought it helped. This was one with severe suicidal depressive episodes that really just put her life totally on hold and did not please her at all. She was quite resistant to any of the drugs, drug, placebo, whatever. It did not work for her, but the actual anticonvulsive therapy that was done for her, she said, really jarred her brain into a whole new pattern. As we've been talking about drugs, I have been referring to a wonderful book called Drug Muggers, and I'm glad to see in my reading that this is becoming more of a point, that more places are starting to realize that taking drugs actually changes the nutrient profile in your body. Antidepressants, especially SSRIs like Paxil and Prozac, use up the iodine in your body. Now, isn't that interesting? The connection between, if you have depression, take thyroid medication, and if you take SSRI, it's going to mess with your iodine. Something definitely is going on here with iodine, thyroid, and depression. Take it to Dreamtime and see what we get. The tricyclic antidepressants like Elavil, norepinephrine, Cinequan, tofranil, anafranil, eat up the riboflavin in our bodies, that's a type of B vitamin, and the CoQ10. CoQ10, you will remember, is that notorious nutrient that is ravished and destroyed by statin drugs. CoQ10 supplements are quite expensive to take, and I have had several people ask their doctor to actually write them a script for CoQ10 if they're taking a drug that gets rid of it. And even though doctors are happy to do that because they know about the problems with it, insurers won't pay for it. So best bet is not to take a drug that is going to draw down your CoQ10. Needed for a good, sharp mind. And MAO inhibitors, those older antidepressants, have a real field day in your vitamin B6. So you're going to need to get more whole grains and more fish in your diet if you're using antidepressants. And isn't it interesting that those foods are known for helping to relieve depression? You've heard me talk about the publication Worst Pills, Best Pills. And their website, I think, is worstpills.org. And they have a lot of really good information, tables and charts and so on, about each of the antidepressants and the major adverse effects. There's a great little chart there, the major adverse effects of the major antidepressants prescribed. And the SSRIs definitely come out looking really, really good. Prozac, Paxil, Zoloft, and Luvox. Basically, the major problems with those drugs are not shown in people who take those. When we get to Wellbutrin, norepinephrine, then the side effects start to get mild and are present. And as we move into things like tofranil, Cinequan, and Elavil, then the side effects become strong or on the high end of moderate. One tip that I found that I thought was very interesting is if you're working with someone who needs to take antidepressive drugs because they are suicidal, it is better to only give them 1 week's supply at a time. Remember that pills in people who are suicidal is not a good combination. Now, it's going to be difficult to kill yourself with SSRIs, so it's less of a problem, but it's still just a good idea not to leave a whole bottle full of pills in the hands of a person who is thinking, goodbye, cruel world. www.worstpills.org in their March 2016 issue had a lead article about SNRIs and which ones can actually be used successfully and which ones to avoid. Again, this is one of the reasons why I, as a layperson, depend on worstpills.org and their newsletter for telling me things like levomilnacipron do not use for 7 years. Although it was approved by the FDA for the treatment of depression back in 2013, there is no evidence that it is more successful or more beneficial than any of the older drugs. And the clinical trials used to prove the effectiveness of it were short, just 8 weeks, included fewer than 2,000 patients, and any serious risks are not going to become apparent until the drug is in widespread use. That's why we recommend that you wait at least 7 years before you use these drugs. That's www.worstpills.org. They also had a great list of all of the drugs that cause depression, and the thing that really kind of raised my hair was that a New England Journal of Medicine study analyzed pre-approved clinical trials for antidepressants submitted to the Food and Drug Administration, and they reviewed 74 trials, which used more than 12 different antidepressants, and the studies were labeled positive, negative, or questionable as far as effectiveness. There are 38 trials labeled positive, and all but one of them were published. There were 36 studies whose findings were deemed negative, but a mere 1/3 of those were published, and of those 14 that were published, 11 of them suggested that the findings were positive, despite the fact that the Food and Drug Administration had said that this trial showed that there was a negative effect of the drug. So what's going on here? I think it's pretty clear to us. Depression can be a normal state for human beings so long as it is transient and lifts. Severe depressions are problematic. They frighten us all because they can have that element of possible suicide. Doctors have at their disposal antidepressive drugs, but we simply cannot prove that those antidepressive drugs work, and worse yet, in populations who are the most vulnerable, they increase the likelihood that that person will think about or try suicide. Antidepressant drugs do not make us healthier, and we cannot really show that they are any more effective than nothing at all. So I think we're going to have a really good time in the next 2 weeks as we look at all of the other herbs, foods, and things there are to do to help us be happier. And I feel a lot happier at the end of this week than I did at the end of last week. How about you, Gemini?
Most definitely. Thank you.
Ending here on the upswing of next week, we will be back with some truly easy and fun things to do because, hey, if you're depressed, that's what you need is something fun. Let's have fun again this week. Okay, Gemini?
That sounds wonderful, Susan. I look forward to that. And this concludes part 62 of our series, The Seven Medicines, The Wise Woman Way with Susan Weed at Time Monk Radio.